Dr Murray from Heal Dental Care. I'm a dentist that has a special interest in fixing people's smiles and providing high quality aesthetic outcomes using the most recent technology available in the digital realm of dentistry. I've got a case here with a patient where his teeth actually developed with some really bad staining, and it was due to medications. So unfortunately, there was no way to clean or whiten his teeth. He'd been teased and bullied as a kid, and I can't imagine what that would have been like for him.
It made me feel terrible, and probably, I don't know, I'm 28 years old and I've never known what it's felt like to feel confident in myself.
He needs a new smile, one that suits his big personality. The thing about fixing teeth though is that no one sees teeth alone, right? We look at people's faces and we see their smile. The teeth are framed within a smile. So the lips, nose, cheeks, all of our facial features matter when we're designing how someone's teeth will actually look in their mouth. So these days we take photos and can actually simulate the new smile in order to plan the design of how the actual teeth will look. Clearly the stains are a big problem. They go deep into the teeth, and so we have to drill away and remove that whole top layer of the tooth structure. It's a small reduction, and it helps us to prepare for what are called porcelain veneers. With the porcelain veneers designed in 3D, we can manufacture them in-house in the dental practice using a CNC mill. Now that the veneers are out of the CNC mill, it's time to finish them by hand. The veneers start purple in their pre-crystallized form, and then later they get furnaced at high temperature and they turn into the white tooth-like color. If the surface of the veneer doesn't have texture, the light will just go straight through the tooth and they end up looking really flat, grey or dull. To add texture, I make small grooves and indents on the surface of each individual tooth with a really small diamond burr by hand. We've had people come off skateboards, surfers knock out their top teeth off the board. One time a PT came in with all of her lower teeth pushed in and bleeding because she'd hit herself in the face with a medicine ball. Like, these things happen all the time. Most people would think teeth are pure white, but in reality, teeth have many layers, lots of depth. They actually have color. I mix pigments by hand into ceramic glaze with just enough liquid so that the glaze adheres evenly to the whole surface of the tooth. We use blue, pink, and even yellow. Now they need to be furnaced. I space them apart to avoid them sticking together or overheating. The veneers come out of the furnace hot, like 800 degrees hot. They have to be left to cool as well, slowly. This is really important to make sure we maintain the strength of the porcelain. Now I'm ready to do a final surface polish. If you over polish at this stage, all of the previous work is undone. You can very easily polish away all of that glaze, color, and beautiful texture that we spent time making before. To get around this, I use a specialized diamond polishing compound on a brush with these unique gaps. It kind of looks like a star. The gaps are between the bristles, which means that this brush can polish deeper into the textured surface. When I do a final buff with a chamois, that's when the luster really starts to come through. Up close, sometimes it seems like a lot of work for one tooth, but when it's all put together, the veneers are in the mouth and the patient smiles, all of those little things, they really do come together and and they create harmony. Most people are excited to see the teeth, but me, I just love to see the difference in their eyes. That brings me joy.